Who are these characters behind the scene who are masked? We don't know who they are. They're at various levels in the military and the government and healthcare. They're preventing the progression of hyperbaric oxygen. We don't know who they are, though.
It's almost amorphous. It's someone, it's an influence at the top, and the people are faceless, nameless.
Is a combination of 100 years of neurology telling us there's nothing you can do for brain injury.
It's like masked cartoon characters where you can't identify them, and yet they're resisting this and preventing implementation of it.
And the hyperbaric medicine community attacking anyone who has applied this to brain injury and who is doing it outside their reimbursed list of indications that they fought so hard to get reimbursed at a very high level in a hospital setting.
And you got to understand, at this point, my goal was very clear. I wanted to get this approved for veterans. And beyond that, once approved for veterans so we could treat these veterans and impact this suicide epidemic, I wanted this approved for reimbursement for everyone with persistent symptoms from traumatic brain injury and PTSD. One of the ways that we can look at this, and an analogy that has helped other people understand what is going on in the brain, the storm inside these men and women's heads after traumatic brain injury and PTSD, was given to me by a 5-year-old autistic child. This little boy, who was so out of control after hyperbaric oxygen became more under control, told me he had alligators and chainsaws in his head. When we looked at his brain imaging, you see a totally disorganized pattern of brain blood flow. And in fact, it was exactly what this child was experiencing. And that is the storm inside the brain of our veterans with traumatic brain injury. It's a disrupted metabolism and blood flow, and something they have absolutely no control over. It is literally a storm inside their heads. And hyperbaric oxygen is calming this storm.
Weapon! Dude, don't do it to another vet! Don't do it to me! Drop the weapon! Drop the weapon! Then let me help you, but not this way! Let me help you! Dude, I'm a retired Army guy! Let me help you! Don't make me do this! Drop the weapon! Please drop the weapon! Drop the weapon, brother! Please drop the weapon! Don't make me do it!
Show the staggering cost of war on our men and women in uniform. More than 30,000 service members have died by suicide since the terror attacks, 4 times as many deaths as those killed in action over the same time period.
One of too many veterans so scarred by post-traumatic stress disorder, he ended his life. But the suicide of Lance Shingler, who served in Iraq, has never been officially recorded by the government. His loved ones believe he'd still be here if he'd had better support.
The panoramic and pervasive dysfunction in the medical community is at such a level that it is truly unbelievable that you could inhibit a therapy like this for non-scientific reasons. I guess that's the way to sum this up.
The outrage and pain over the way veterans were treated at VA hospitals.
Now to the VA scandal, which is now a criminal investigation. An extensive new report reveals more than 100,000 veterans waited months to see a doctor or never saw one at all.
It reached a new fever pitch today as families lashed out about a healthcare system that failed some men and women who served this country.
A moment Julianne Finney has spent years fighting for.
This report is for David. It is for David and the many others like him.
Her son David took his own life in 2019 after a 2-decade career with the Royal Australian Navy. She was instrumental in the campaign to establish the Royal Commission into Defence and Veteran Suicide.
It has to be the turning point.
Today, after 3 years, the final report tabled and handed to the Governor-General. At the doorstep of Parliament, the 3 commissioners with a scathing and blunt assessment.
The problems are clear. They're not new, but they're clear. And we hope that the Royal Commission has achieved one thing, which is to make the problems undeniable.
Since the advent of man, warfare has been an integral part of human existence. Unfortunately, in the modern era, part of warfare has now become medical warfare. We have undeniable evidence that hyperbaric oxygen therapy is the most effective treatment for traumatic brain injury and PTSD. Yet, it's not being accepted and applied. And the battle is being fought amongst the doctors. This is medical warfare now, where the science and the evidence is there, but it violates belief systems in medicine, and it gets even to dirty politics. And the failure to acknowledge the data, acknowledge the science, and admit that mistakes have been made and some people are wrong in their positions about appreciation of and understanding of hyperbaric oxygen therapy. There are many obstructions within this battle. In particular, the studies done by the Department of Defense were done by and overseen by CEO of the Department of Defense's drug company. In June of 2013, at the annual scientific meeting, Dr. stood up in front of the audience and introduced himself as the CEO of the Department of Defense's drug company. There was pin-drop silence in the room. Everybody was stunned. And he chuckled. Yes, I bet none of you knew the DoD has its own drug company. We, in fact, design, synthesize, test, and implement drugs.
Straight across their face. Here we go. She's on. The gloves are back on, and it's going to be a fight from hell. Defence and the government cannot be allowed to cherry-pick the recommendations that work for them. The military justice system, the chain of command, has misused and abused the legal processes to target veterans. They did everything they could to resist a Royal Commission. They aided it and abetted by the National RSL. They kept telling me and the veterans nothing to see here. The National President of the RSL even went after Julianne Finney, accusing her of campaigning for a Royal Commission to search guilt for a failed relationship with her son. You, Mr. Melick, subsequently apologised, but I have to ask why on earth this man is still the head of the National RSL. It is certainly not the request and it is not the want of every digger who has served and previously serving.
The Canadian military is investigating another apparent suicide of a soldier, the fourth in just over a week. And the tragic cases may only hint at the magnitude of the problem. Some say the military would rather get rid of them than give them the help they need.
There is a process and a treatment to help our soldiers and Marines and our Navy when they have PTSD, when they have TBI, and it's called hyperbaric oxygen treatment. Are you familiar with this process?
If it can help, I'm in. We should, for our people, explore every avenue that we can to help them recover from what are really becoming some signature wounds of this war that we're in.
You're white male, approximately 30 years old, wearing a black hoodie and a military-style hat.
Bustos, I think he's on the south side of the parking garage. Hey, put your hands up. Put the weapon down! Put the weapon down! Put your weapon down! Drop the weapon! Drop the weapon! Get me somebody up here with less lethal. Do it now.
Am I angry? I'm livid. When we started all of this and showed the first cases with functional brain imaging, the changes we showed with each of these cases has never been seen before in functional imaging. You cannot explain it with placebo effect. In the first publication on a series of veterans, in the veteran study we did at LSU School of Medicine here in New Orleans, the conclusion of the article is you cannot explain these results, in particular the imaging, with a placebo argument. In other words, we essentially proved it. And with each of these functional imaging studies, we proved the effectiveness of this. But we were told you didn't have enough evidence. Okay, so I played the academic game. You got to generate the evidence. You got to do the studies. I was told to start with a pilot trial. We did that. That's the one that says there is no way this can be explained by a placebo effect. In other words, these are remarkable changes. And the statistical conclusion was that the possibility of explaining all of these positive results as a random event is less than 1 in a quadrillion. Is that undeniable evidence? But that wasn't enough. We had to do a randomized trial. And then we had the VA and the Department of Defense do studies. The studies now unequivocally show, in a systematic review in 2022, looking very technically at all of these studies, the conclusion is level 1 evidence, the highest evidence in medicine and a grade A practice recommendation, which says that this treatment should be delivered to people with traumatic brain injury, with or without PTSD, unless there's a compelling reason not to. There is no compelling reason not to. So why is it not being delivered? Part of the problem is there is new science that finally came to the forefront in 2010 and 2008. And unfortunately, the doctors will not acknowledge this because they feel that it's an admission of being wrong. You can be wrong about things. The problem with this is that being wrong and maintaining this ignorant position is continuing to deny this therapy to hundreds of thousands of veterans. And that's just in the US. When we expand this to all of the patients with traumatic brain injury, worldwide, it's millions and millions. How do you excuse that? Oops, I made a mistake. You can admit, okay, we now know new science, and let's get on with it. But human nature is preventing that. And, of course, the bottom line, the VA, the military, they don't want to pay for it. And yet it's cost-effective and cost-saving. And the effect that it can have on the quality of life of these veterans and people with traumatic brain injury is beyond calculation. Am I angry? You bet I am. We played the game. We generated the evidence. We've satisfied all of these criticisms, and yet still it's not being applied.
I did 24 years in the Army as a paratrooper. Don't make me do this, brother. I'm here to help you, but I can't help you if you don't give me a chance. Okay?
Me in the fucking face, man. Just
I can't help
end
you.
it.
I want to get you help. I want to. Well, I can get you some help, and I can get it to work. This ain't the way to do it, man. I'm telling you, this ain't the way to do it.
Fucking end it.
Okay? Come on, brother. Let me help you.
Fucking end
One
it.
soldier to another.
Shoot me in the
Let me help
face,
you.
man. Just fucking end
I don't want to do that, man. I don't want to do that.
Fucking shoot.
I don't want to do it. Come on, man. Come on, brother. I don't want to do it.
Shoot me.
I don't want to do it.
Shoot me in the
I don't want to do it,
face,
man.
Just fucking end it.
I'm here to help you, brother. I can help you. I got a Marine on my right, and I know I got a soldier on my left, and I got you in front of me, and I can help you. We can help each other. This ain't the way to do it, man. This ain't the way to do it.
Fucking end it.
Honestly, it ain't the way to do it, man. Come on, brother. Help me. Don't make me do this. Don't make me do it.
Shoot me in the fucking
No, there
face,
isn't.
man. Just
No, there isn't. You believe in Jesus Christ, brother? Don't do
me
it.
in the fucking
Don't do
face,
it.
man. Just fucking end
Don't do it. Don't do it. Don't do it, brother. Don't do it. But I can't help you if you don't help me. Okay? The Lord sent me here to you today. He didn't send one of these other guys. He sent me as a vet to you to help you because I'm there. I've been there.
After nearly 11 minutes of having his gun leveled at the man, pleading with him, that standoff finally ends.
Just drop it. Put your hands on your head for me.
At that moment, Richard Jones knew he had succeeded in saving the life of a veteran just like him, who was in a mental health crisis.
I'm fine. Let me go make sure he's okay.
No, he's good.
Yeah, I promise you that.
Where's the closed car? Closed car.
I'm sorry, bro. I'm sorry. I'm sorry. We're gonna get you some help, man. Okay? Okay? Understand, man, I've been there. It sucks, bro. Dude, it sucks. He's there too. We're all there. Most of us are all vets, man. And this ain't the way we're supposed to be treated, okay? I'm gonna tell you, I'm gonna get you some help. We're gonna start right now. I'm gonna get you over here to Parkview and we're gonna get it taken care of, okay? I love you, bro. Good job, man.
Made a good
job,
decision,
Andrew.
everybody.
Come on, let's
guys
get you up
close?
there.
They close right here?
Put him in my car over there, 642 or whatever.
After gathering himself best as he could, he went to the fellow vet and hugged him.
I'm gonna tell you, I'm gonna get you some help. We're gonna start right now. I'm gonna get you over here to Parkview and we're gonna get it taken care of, okay? Love you, bro. Good job, man.
Were you prepared at any point to shoot him?
I was prepared from the minute I left my vehicle and I approached that vehicle and he stood up with that gun. I'm thankful I was there that day. And I'm thankful I've had the experiences that brought me there that day. Because when I think about some of my younger officers, I don't know if we would have had the same outcome. We deal with a lot of these cases and we get a lot that have weapons with them. There's days that we're one after the other. This is normal. People just don't understand. I've left this patient with the mental health counselor, gone to the station, finished my paperwork, come back out, and then patient's walking down the street in front of me.
No place to put them.
This is ridiculous. The normal person doesn't know. Politicians don't have a clue. They do not have a clue about it.
We knew we had a treatment for the problem that was decimating our active duty military, traumatic brain injury and PTSD. And we thought this was going to be a straight shot to implementation. But we had no idea the obstruction we were going to encounter. We were even more surprised by the source of it. The Department of Defense sent investigative teams to see what we were doing and validate reports of improvements in these veterans. It culminated in a meeting by Army Surgeon General's office sending their finest group, top neurologists, clinical trial specialists, neuropsychologists, imaging specialists, and I believe statistician was the fifth one. By that time, we completed the veteran study. All 30 veterans had been treated, data collected, and statistics on the first 16, then the next 8, and the last 6 had the data. It was all positive, but we didn't have statistics yet. And we shared it with them. The response was they wanted us to give them the data for them to do an analysis. That's never done in clinical trials. You never give your data up until you've had it peer-reviewed and published. And I told them, why don't you just wait till it's published, then we can go from there. Over the next 5 months, there were repetitive requests, and again, I said, just wait. Finally, in November of 2011, that first half of the study and that data got published, and it was online. I sent the colonel an email, and I said, it's up. Look at it, and if you have any questions, give me a call. Very shortly, I had an email response that was extremely disturbing and even threatening. The email suggested they were going to block our publication, and I can't tell you how low I felt. It was like all the blood drained out of me. I don't remember feeling this defeated and low in 25 years since that incident with the medical society. I immediately called the ex-secretary of the Army, Martin Hoffman, who was working with us, and asked him if there was anything he could do within the military to get to this problem that was developing, and he couldn't. We waited, and 2 days later, got a phone call from the editor of the journal that we just published the article in. He said, a top military medical officer who said he had seen all of your data. I named the doctor, and he was silent. He said, I've never had anything happen like this in 25 years of journal editing. He said he'd seen all of your data. You only published the positive data. The rest of it was negative, and therefore your publication's a fraud and misleading. And if we don't retract it, what he told me was he threatened me with my credibility and the credibility of my journal if we didn't withdraw your article. The journal editor said, look, we vetted Harch's team every way we could. We couldn't find anything amiss. And we had our finest reviewers review his paper, and he rewrote it 3 times. And unless you can prove fraud, the publication stands. The colonel repeated his threat to destroy the credibility of the journal and the journal editor. And the journal editor repeated, unless you can prove the fraud, the publication stands. And then there was silence. And the colonel responded, I am sorry for what I just had to do. I have never done anything like this in my life. It's completely out of character for me, and I want to apologize. And hung up. The publication stood. But what was so disturbing about this was the realization that we weren't all on the same team. I thought everybody was working together, military, Department of Defense, veterans, donors, us, everyone trying to find a treatment for these veterans with traumatic brain injury and PTSD, and we had undeniable evidence that this could help them. It turned out we were being obstructed. The enemy was within, and it seems that others had a different agenda.
So the colonel involved in blocking the publication and blocking the meeting at the Pentagon is also the CEO of the Department of Defense pharmaceutical industry. The person who should be objectively evaluating the use of hyperbaric oxygen for the military men who have suffered traumatic brain injury is also the person who's manufacturing medications, which may not be of need if hyperbaric oxygen is used.
I know your patience only goes so far, and I know for many, many years you have been fighting a government who has destroyed you. I know that. But the biggest enemy I have right now, and that we have right now, the veterans out there, are you people. You people, because you won't come together as one. For God's sake, even the Vietnam veterans worked it out. They only split into 2 groups, not thousands. That has been extremely harmful to us. I want you to go away and think about that. I want to see you like a one group, one union.
There is a process and a treatment to help our soldiers and Marines and our Navy when they have PTSD, when they have TBI, and it's called hyperbaric oxygen treatment. Are you familiar with this process?
I have seen none out there that I'm more encouraged by than what I would call at this point the ad hoc results of hyperbaric treatment. Now, to the point where we have put the Assistant Commandant of the Marine Corps in charge of trying to speed the process of the protocol that Navy medicine must necessarily accomplish to rapidly bring this to treatment level for our Marines that we think are affected. In the meantime, there is a doctor down in New Orleans who treats people. We have sent forward those Marines suffering that we thought might be suicidal.
Did you hear that? That doctor in Louisiana is me, Dr. Paul Harch. 16 years ago, I sat here and told you that I had evidence that we could treat patients and improve them with hyperbaric oxygen who had chronic traumatic brain injury and PTSD. This was based on individual cases I treated, a case series, and an animal model where we duplicated in animals what we had done in humans. It was the first ever and only improvement of chronic brain injury in animals in the history of science. But I also said that nobody else had this experience, and the scientific community demands more proof. So I said there were studies underway, and that this was going to be a process of education. We were going to have to do the studies and then inform the scientific community, the lay public, insurers, the Department of Defense, the VA, that we had undeniable evidence. Here I am 16 years later, and I'm angry. I'm out of patience because we've done the studies. The studies have been done by others as well. We did a study in veterans. We did a randomized trial of civilians and veterans. Others then did randomized trials duplicating the same experience. And there are imaging in these studies showing changes in brain blood flow, improvements in brain blood flow metabolism that have never been seen with any other therapy. And yet, it's still not accepted and it's not reimbursed. Why is that? It's a matter of dirty politics. And I didn't understand this until 2 months ago. I couldn't explain it until my second application to get this reimbursed was rejected. And the reason it was rejected was not that there's undeniable evidence. There's too much evidence. And if this treatment was approved for these diagnoses, it would cause scrutiny of all of the other diagnoses that hyperbaric oxygen is reimbursed for which there is far less proof, and thereby threaten the financial stability of the field. That's called dirty medicine and dirty politics, but it's clean science. But what's the consequence of denying this evidence? The consequence is the storm inside the brain of those with TBI and PTSD continues unabated, and with it, broken lives, broken marriages, broken families, unemployment, homelessness, helplessness, drug addiction, and suicides to the tune of 22 a day just in the veteran population. And why am I so angry? Because this isn't fair. We've got the evidence. It should be reimbursed. I can get this therapy. For me, for anybody in my family, but you can't. And you can't because it's not reimbursed. And that's wrong. That needs to end.
But he is finally coming to this realization, and he's becoming almost more spiritual in that he is looking for a miracle, a break, a black swan, a divine event, something, someone, somewhere to intervene and bring this to the public. Because investigative reporters, the biggest news television stations in the United States, the very top of the news media, and Congress will not tackle this.